we're going to move the bottles of blood away from the heart. And when we diagram it on the board, give numbers and kind of write a code for it. And once we go through a few, we'll talk a little bit about blood tracing. Okay? We're going to start first with the aorta, as it carries blood away from the heart. So I'm going to draw the aorta coming down here so we have room to move up into the head and neck and head. So the aorta rises obviously out of the left ventricle, and I'm going to come back through and erase some old things into this, and turns posteriorly. Obviously, I can't do it completely posteriorly, so I'm going to draw it going to the left. And it does go to the left, but behind the heart. All right, so if you look at a model of the heart over here, you have the ascending aorta, the arch of the aorta, and then it comes down behind the heart as the thoracic aorta. So there is a bit of a loop there, but it's not as far to the left as I'm going to draw it, just because I can't draw it posteriorly behind the heart. So actually I'm going to bring this down a little bit. I have more room up at the top. And I consider there to be 4 parts to the heart. You'll see a lot of textbooks that talk about the ascending aortic arch and descending aorta. But we divide the descending aorta into thoracic and abdominal once it passes through the diaphragm. So what are the first vessels to come off of the aorta? What are the first vessels to branch from the aorta? We've talked about them already. Nope. Maybe if I put them in here.
Common carotid artery?
Nope.
I'm just guessing.
That pair of vessels right there.
Oh.
Coronary arteries, yes. So, so what is ascending aorta? And it has 2 vessels which branch off of it. And we'll label those number 4. We'll come to those in a moment. 2 is the arch of the aorta, or aortic arch if you don't want to write a bunch of words. And 3 is the thoracic aorta. Actually, let's make 4 the abdominal, although we're not going to get to it for a little while, just so we have these in sequence. So 4 is the abdominal aorta. Once it's past the diaphragm, it'll change to that name. And then 5 will be the coronary arteries. So right and left coronary arteries, and 2 A's is my shorthand for plural arteries. Okay? So the first vessels to branch off the aorta are the coronary arteries, although like some of you, textbooks will say the brachiocephalic trunk. Brachiocephalic trunk is the first vessel to branch off, is the first vessel to branch off of the aortic arch. So these next few images here, before we get to a close-up view of the brachiocephalic trunk, are images that I've accepted that students have sent me, drawings that they've done on themselves or their kids or their boyfriends or girlfriends or whatever, as a means of practicing these vessels. So some are messy, some are quite detailed, some are labeled, some are simple. I would advise doing this because it's really helpful, not just the visualization, but the tactile information that you get of where the vessel is on the front or the back or the right or the left, okay? And then as you think about the flow of the vessel, trace a drop of blood from the heart to somewhere or back to the heart, then you get a better idea of where those are. But I would use water soluble. You can get washable colors from the drugstore or whatever, okay, to get through those components. All right. the aorta. This is asymmetrical. So this first branch goes to the right side of the chest and supplies the right head and neck. And it is not present on the left side. So this will be number 6. And this is known as the brachiocephalic trunk. Usually when we use the word trunk, that vessel itself, like the pulmonary trunk, isn't supplying any direct tissue, it's branching to form something else, okay? So brachio stands for arm, and cephalic for head. So this vessel is going to give off 2 branches, one goes to the head, one goes to the upper extremity. So the first, the one going to the head is called the common carotid. And the one running along the base of the neck to the upper extremity is identified as the subclavian. On the left side, the common carotid comes directly off of the arch of the aorta, as does the subclavian. Okay? So there is no brachiocephalic trunk on the left side. On Thursday, when we talk about the veins, there will be, which brings me to a point I want to make. I haven't actually compared numbers to numbers, but about 85% of the veins carry the same name as the artery that they're found with. So study the arteries really, really well, and you'll already know the veins, most of them, okay? We have some additional ones in the, like we don't have a common carotid vein, we have jugular veins, all right? And we have superficial veins in the skin of the upper and lower limbs, and we don't have arteries, obviously, in the superficial of the skin because it's too dangerous if they get cut. But the deep veins and the arteries carry the same names. The better you know the arteries, the less you'll have to study the veins. Question, Caitlin?
Why is this, so like, you have the brachiocephalic trunk for 6 up there, but on the one in our.
Because I have no idea what I've written down
Oh,
for
okay,
numbers
so
on that.
don't follow that at all.
You can look, I mean, you can use those numbers, it's just I'm
Okay.
numbering them as I go through it, I don't have that diagram memorized. All right, so no brachiocephalic trunk on the left side. And we have a common carotid coming off the brachiocephalic trunk, as well as a common carotid coming off of the aortic arch. Okay? And we'll come back to the subclavian, so we kind of follow the numbers. It's a little different than I numbered it last night. But let's follow the right common carotid up. I'm gonna leave the left common carotid where it is, okay? And we're gonna take the common carotid up. It supplies both the face, external to the skull, and it gives a branch that goes into the brain. Okay, question?
Is there a common carotid to the right and left?
Yes.
Okay.
Yeah. I did not require that you identify right and left other than the structures associated with the heart, like right and left coronary artery, right and left atria. There are a few times where right and left are distinctive. So, for instance, in the gonadal veins, the right gonadal vein drains into the inferior vena cava, the left drains into the renal vein. For the arteries, the left gastric is part of our celiac trunk, the right gastric comes off the hepatic artery, so we won't even deal with the right one yet. So when there is a distinction, I'll let you know, but otherwise, you can just label it for the artery, you don't have to include right or left. So, common carotid, on the right, common carotid comes as a branch of brachiocephalic trunk, whereas on the left, it comes directly off of the arch of the aorta. So if you were tracing a drop of blood from the heart to the face, on the right side of the face, you would go the ascending aorta to the arch of the aorta, to the brachiocephalic trunk, to the common carotid artery, all right? If you were going to the left side of the face, you would go ascending aorta to the arch of the aorta to the common carotid artery. You would miss the brachiocephalic trunk. So when we do the tracings, and we'll look at some examples of those on Thursday, I supply some of the names as hints or crutches to help you get an idea of which way I want you to go, okay? All right, so common carotid, you can see here, is going to divide into external carotid and internal carotid. External carotid is going to stay external to the skull, and supply the skin and face muscles outside of the skull. Internal carotid is going to go through the carotid canal and supply brain. So as I draw these branches, I'm going to extend way past the midline, which is why I don't do it for the left common carotid, okay? Because it's not going to be proportional, just so I have enough room to draw. The common carotid branches right about the angle of the jaw, okay? And it's going to give off the external carotid, while the internal carotid is going to go up into the brain via the carotid canal. Now, on your lab list are some names of vessels that I'm going to skip. If I don't talk about them, you don't have to know them, okay? So I think one of the early ones here is superior thyroid, which is a branch of external carotid. So I'm not going to talk about that. I vary from semester to semester whether I do or not. So as you're looking through the lab list, if I don't talk about it, you don't have to know. So we have external carotid. And we'll number that 8. And then we have several branches. So the first one we're going to talk about curves around the side and to the back of the head. And this is called the occipital artery. So you can see it on a couple of our models. On the head models, you can see it here, coming around to the back of the skull. And you can also see the facial and superficial temporal artery model on that one. And the other set of models are these over here. So here's the common carotid, here's the external carotid, and internal carotid, all right? External carotid is going to give off the facial. It's not what's not shown, but back here is occipital artery, all right? So you can find them to varying degrees on these two sets of models. Just remind yourself that these are outside of the skull, okay? So 9, and I'm going to put an asterisk beside that because it's a branch of external carotid, is occipital artery. Superior thyroid to the thyroid gland and anterior neck, the lingual artery to the inside of the mouth, we're not going to cover. And so the next one that comes off is a highly convoluted artery that crosses your mandible and goes across your face up the side of your nose. And if you take a couple of fingers and lightly palpate along the edge of the body of your mandible, you can feel a little divot where the masseter muscle stops. And if you just place a couple of fingers there lightly, you should be able to pick up a facial pulse, which is the expansion of blood through the facial artery as it crosses from external carotid over your mandible. So this will be number 10. And then as the external carotid artery continues up along the back, deep to the jaw, it gives off another vessel behind the mandible. Oh, it's not called the mandibular, it's called the maxillary because it runs inferior to the maxillary artery. The maxillary bone, rather. This applies the deep muscles of your deep chewing muscles of your face. So like the temporalis muscle, the pterygoid muscles you learned about in Bio 430. And it gives off a small little vessel that passes into the skull but does not supply the brain. And I don't know if you learned the foramen spinosum of the sphenoid bone last semester, but this vessel, which is a branch of the maxillary artery, is the middle meningeal artery. And it supplies the inside of the skull and the meninges, like the dura mater, not the brain. The framus spinosum is the tiny little, I don't know if you remember the openings of the sphenoid bones for the trigeminal nerve, but they kind of form a crescent, and we have the superior orbital fissure, foramen rotundum, foramen ovale, and then foramen spinosum is the tiny little dot at the foramen ovale. And instead of a nerve going through that, the middle meningeal artery does. And in fact, as it travels along the inside of the skull, and it's not shown there, the osteoid of the skull is still pretty soft, and it creates grooves along the inside of the skull cavity. And on this model, if you look inside this clear plexiglass, you can see the little middle meningeal artery on the anterior aspect of the temporal ridge. This is often a cause of subdural hematomas because it runs along the inner surface of the temporal bone where it's very thin, and if that gets fractured, branches of the middle meningeal can be torn. And of course, the skull's not going to swell like your skin does with the bruise, and so it pushes, the pressure pushes inward on the brain, and that's the temporal lobe where we have memory from the hippocampus, and so it often will affect memory, temporarily at least. So 12 is middle meningeal, and finally the external carotid artery is going to end by forming 2 or 3 different branches along the outside of your skull. So right up here you can feel a pulse, especially if you have a headache, and that's the superficial temporal arteries, multiple branches, but we just give it the one name. And the reason we call it superficial is because deep temporal arteries are branches of the maxillary, but we're not learning those, okay? But that's why we call these superficial temporal. So that's also a branch of external carotid. And superficial so that one, although it can be seen on the outside of the skull, on the model over on the counter, on the opposite side is this one here, where it's traveling along the temporalis muscle, okay? So along the side of the temporal bone, that would be the superficial temporal artery. Now, you can see maxillary artery on that skull. You can also see it on this model, although this one's a bit more confusing. It just has so much stuff there. But the ramus of the mandible has been cut in half, and the coronoid process and condyle have been removed. And so if you look in there, you can see the maxillary artery, which is number 20, and number 24 would be the middle meningeal artery passing up into the skull. Okay. All right, so those are the branches of the common carotid, branches of the external carotid, and then this is the internal carotid going through the carotid canal to get into the skull. So the next thing we're going to talk about is the blood supply actually to the brain. Let me just finish one thought. And there are 2 vessels, 2 pairs of vessels that carry oxygenated blood to the brain. We have the 2 left and right internal carotids, and then we have the very thin vertebral arteries. Remember, this is why we have the transverse foramina of the cervical vertebra. It's because it supports and protects these vertebral arteries as they pass up the cervical vertebra. You can see that on that model as well. Vertebral artery is a branch of subclavian. So we'll come back and number that when we're done with the brain, but I want to draw this up here. And vertebral artery is actually going to move through the foramen magnum. So our next number is 14. You have a question?
Oh, is the middle meningeal, is it also the middle cerebral, or is that 2 different?
No, that's a different one. We're going to cover that as soon as I write down vertebral and erase the board. Middle cerebral is supplying the brain. It's actually a branch of internal carotid. So notice how I diagram these, I do them as an outflow, all right? As if you were following a road away from your house or from the college going some direction. So this is going from high pressure to low pressure, so this is direction of the blood flowing away from the heart, all right? So if I said trace a drop of blood from the heart to your nose, the right side of your nose, then you would go ascending aorta to the arch of the aorta, to the brachiocephalic trunk, common carotid, to external carotid, to facial artery. Okay, just like you were making right and left turns down the street. Now, we're looking at these in regions. So we're doing head and neck now, all right? Then we're gonna do the brain. Then we're gonna do the upper limb. And if you think about it all at once as you drive home tonight, you're gonna be overwhelmed. You may anyway. But what I'd like to get you to do is to learn it by regions. Many of these terms are already familiar to you, okay? Facial artery tells you where that vessel's gonna go. You already know about the occipital bone, so that tells you where that blood vessel is going to go. So lecture questions, lab is just, I'll tag a vessel on a model or diagram and ask you to name it. Lecture questions are going to be in the form of the occipital arteries are branch of which of the following? Or all of the following are branches of the external carotid artery except. Or which of the following arteries supplies blood to the back of the scalp? So those supply branches from and so on. However, as you practice these and do practice them, as I told the class last night, if you come to the Friday open lab, we do have, remember the paper I brought out for the clay modeling and stuff, that book, this butcher paper, it's pretty cheap. I'm pretty sure if you ask Jeff to get you some, you can go in there, tear it off, and you can practice drawing on that or on the board, okay? Because practice diagramming these helps you learn them in sequence as far as where the structures are going. I would encourage you to do that because if you practice enough, then you'll get scrap paper with the lecture exam, all right? For the lab quizzes, you can draw it on the back. But pretty quickly, you'll learn that you can draw this. So here's the ascending aorta, arch of the aorta, thoracic aorta, coronary arteries. Brachiocephalic trunk, subclavian, common carotid, external carotid, internal carotid, vertebral, occipital, facial, maxillary, middle meningeal, superficial temporal. Okay? I did that in less than 10 seconds. Of course, I've done it for years. But notice I didn't draw it very carefully and distinctively. I didn't draw it nice and neat with the double walls. But I drew it. So if I go back and let's say I ask a question, what are the branches of the external carotid artery? Don't, bother labeling them as you draw them out. Just look. You can say, okay, here's occipital, here's facial, here's maxillary. Whatever other answer I have on there is not on there, okay? And so instead of trying to visualize this and open a new file in your brain every time you read a question, you've got it all down on paper, and you can just look back at that diagram, okay? So as you're learning these regions, draw them over and over and over, even if you're not drawing them on your person every time. Then not only will you see that with your eyes, but your skeletal muscles will get used to that drawing, and it'll be easier for you to remember these questions. You have it in front of you while you're answering a question. You're looking at that instead of trying to see that image in your mind every single time I ask a question about this region. So you can draw the regions separately, or you can draw them as all one body. It's totally up to you, whichever you find more convenient or more helpful for you. Okay? You can draw them on the side of the shower with your shampoo. You can, if you're digging out in the garden, you can drag your sticks through the dirt, whatever. Just a few regions at a time that will help you remember that. All right, so I erase the board, and we'll look at, let's apply to the brain. So in Bio 430, we looked at the venous sinuses, and we'll review those on Thursday. But sometimes I do the vessels, the arteries in Bio 430, and I did not last semester, so we're all in the same boat. So may I erase these? Okay. When I come back, we're going to look at, I haven't named the carotid canal yet. I'm sorry, the internal carotid artery. So let's go ahead and number that here. And internal carotid artery will be here.
So Thursday is gonna be on all of these?
Yes. Did you get some last time? Tonight and on Thursday? So our schedule coming up is, this is not as bad as all the bones and their processes
No.
and stuff.
This is way
We got
worse than bones.
Huh?
Bones have different shapes, arteries look the same.
But they've got names to where they're going.
Oh my god.
And similar to muscles and nerves of the same region, okay? So,
And tissue.
on Thursday, we'll finish up the lower limb and do the veins. Tuesday is blood pressure. And we'll come back to cardiac output, heart rate, and stroke volume, and we'll add the resistance of the vessels. And we'll review, because that brings into review everything we've talked about. Thursday then, we start blood cells, which will not be on your exam. Lab time will be reviewed, okay? So we'll lecture on blood cells, which might say just send the order off to the printers tonight. But the lab time, there will be our lab time for blood cells will be after the exam. So lab time on Thursday, will just be previous material. If you wanna look at the heart, if you wanna look at blood vessels and so on. All right. Question 3. Identify the first vessel to branch from the aortic arch. So I did not say the aorta, right? If I said the aorta, what would the answer be? Coronary arteries. That's what we learned, right? Okay, would anyone like more time on question number 3? The aortic arch, by the way, has 3 branches. You probably didn't pay any attention to them when we were looking at the model, but they're shown right here, a little close together, all right? So first, second, and third would be the 3 branches off of the aortic arch. One goes to the right side of the body, the other 2 go to the left side of the body.
Do we only label, one of the 2 right ones? Like, do we only label the middle and the left?
We haven't labeled the far left one because I didn't label it on either side. So remember the brachiocephalic trunk has 2 branches, common carotid and subclavian. And then common carotid comes off the aortic arch directly, and subclavian on the left side does as well, but I remembered the subclavians for either one. All right, so here's the brachiocephalic trunk. And it gives off the external carotid, which we already talked about. And then the vertebral artery also comes off the subclavian. Here the common carotid is coming off directly to the aortic arch. And here's the rest of the subclavian going on, and here's the other vertebral. So now we're gonna look at those after they come into the skull, okay? The vertebral arteries come into the skull by exiting the transverse foramina, crossing over the first cervical vertebra, and passing through the foramen magnum. So both vertebral arteries come into the skull via the foramen magnum, and you can see it on that arterial skull model there. Whereas in carotid arteries, as I drew on the board, come through the carotid canal, okay? They're much larger, and most of the blood coming to the brain is coming through the internal carotid arteries. But they join inside the skull, underneath the brain, to create an anastomosis, a joining of the vessels. So if the carotid arteries can be blocked almost 90%, and we can get adequate blood flow through the vertebral arteries. That gets to all of the brain because of that anastomosis. So this is called the old name for the fact that these were all joined together. Here's the pituitary gland and the optic nerve, mammary bodies of the hypothalamus. So this old term was the circle of Willis. That's because they all join together and blood flow can come from different directions. The current name is the cerebral circuit, okay? Which is, like I said, we take away people's names. So I'm gonna start with the vertebral arteries here. Because they're coming in with the spinal cord as it transitions to brainstem through the foramen magnum. And then we'll move up and see the entrance of the internal carotid arteries as they are cut right after they pass through the carotid canal. So we have the pair of vertebral arteries. Passing through the foramen magnum. And what number did I give vertebral arteries in the Peter-Fritz diagram? 14? 14. Actually, I'm going to take away the 15 from the from the internal carotid, and we'll number it as we get to it. So 14 are the vertebral arteries. And there are a pair of those. And as you can see on the diagram, they come up with the spinal cord and they pass on the ventral surface, the anterior surface of the medulla. So a lot of their unnamed branches supply the medulla. They're named, I'm not gonna have you learn them. So if we have a blockage or a rupture through an aneurysm of the vertebral arteries, that usually results in instant death. Because if you recall from Bio 430, the medulla oblongata is where we have our cardiovascular center, regulating heart rate through the vagus nerve and sending impulses down to the sympathetic, and where we have our respiratory centers. If those are affected, your heart stops and your respiratory system stops. We do have branches that we are going to name, a pair of branches that come off of the vertebral arteries once they're inside the skull. And I'm going to number these 15, so we're going to change 15 to 14. And the abbreviation for these is pica, which is weird because that's somebody likes to eat dirt or other things, it's called pica. But here pica stands for posterior, inferior, cerebellar artery. So as you can tell, this is going to the cerebellum. So that will be, well, I guess I should have written the number down. That will be number 15. And this supplies the cerebellum. So this information I'm giving you in blue is the electrotype content. So we have these vessels of these models of the brain in here. Even though brain is Bio 430 content. These vessels are part of our 431 content. So here's the cerebellum. Okay. This is the superior surface, and this is the inferior surface. So these vessels on the inferior aspect of the cerebellum are the posterior inferior cerebellar arteries and their branches. So the name of the vessel tells you what tissue they're supplying. All right? Bless you. Then the two vertebral arteries join together and pass over the swelling of the pons. So if you took Bio 430 from me last semester, I called that swelling. It's because of neuronal nuclei forming the middle cerebellar peduncle going to the cerebellum. And I described it as a pregnant belly or a beer belly for the guys. And that's the region of the pons called the basal pons. So the single vessel formed by the fusion of the vertebral arteries is called the basilar artery for basal pons. It has branches that come off of it, but we're not going to diagram them or learn them, that supply the pons. So 16 is basilar artery. And that's the vessel structures of the vertebral, okay? Then, the other components of the circuit are branches of the internal carotid. And they come in from the carotid canal, pass forward and up, and then finally into the cranial cavity right near the sella turcica, where the pituitary gland is. So I'm going to draw the internal carotid arteries. Whoops, we've got to finish this one. Sorry, come back to that. So the basilar artery ends by forming dead ending into the posterior cerebral. We have 3 sets of cerebral arteries, anterior, posterior, and middle. And so the posterior cerebral are going to be number 17. And that would be these vessels right here. Okay. They go to 2 regions. I'll show you in just a moment. They're going to supply the cerebellum as well. You can see them coming in here between the cerebellum and the occipital lobe of the brain. So they're going to supply the top of the cerebellum, okay? And they're going to supply the occipital lobe. What's the function of the occipital lobe? In one word? Sight, or vision, all right? So if there's a problem with blood supply, that's going to interfere with your vision. So posterior cerebral arteries supply the cerebellum and the occipital lobe. All right. Then we have the internal carotid, which has been cut here. And finally, internal carotid for the previous diagram, if you want to name it, number it on that too, will be 18. Excuse me. And as such, it's not supplying anything, it's just giving rise to branches of vessels. So we're not going to put any region specific to internal carotid arteries. And it has 2 branches. A pair of large middle cerebral here that pass between the temporal lobe and the parietal lobe through the lateral sulcus, and a much, much smaller pair of anterior cerebral. So posterior cerebrals are branches of the basilar, middle cerebral and anterior cerebral are branches of the internal carotid. So middle cerebral is going to pass through deep to the temporal lobe, and it's going to supply all of the temporal lobe and most of the frontal and parietal lobes. This is middle cerebral. And before I write those regions on the board, let me show you. So here's middle cerebral right here, coming off of the internal carotid, branching around. Notice how it's covering the insula. So it's going to supply the insula, it's going to supply all of the temporal lobe, and then it's going to supply where my hand is, all of this lateral aspect of the frontal and parietal lobes. Okay? So, insula, temporal lobe, all of that, and then the lateral aspects of frontal and parietal. Okay? So it's coming through here, supplying insula, supplying the temporal lobe, and then supplying all of the outside aspects up to about a half an inch from the longitudinal fissure of frontal and parietal. Okay? So I'm gonna step between here and here. Move up here. So here's the middle cerebral. It's going over the insula, supplying the temporal lobe, okay? And then wrapping around the outside of the brain and supplying most of frontal and parietal, the outside part of it. So if someone has a cerebral vascular accident and they are paralyzed or they have a lot of sensory loss, it's usually some component of the middle cerebral. So here's the middle cerebral coming off of the internal carotid, passing over the insula, all right? Supplying the temporal lobe, all of the temporal lobe, and then this part of frontal and parietal that I have my fingers. So the outside lateral aspect, the medial surface will be supplied by the anterior cerebral. Okay, so again, middle cerebral is there, passes over the insula, supplies all of temporal, and then up until about a half an inch from the longitudinal fissure, all of the frontal and parietal lobes. Okay, so it's the largest and has the largest region for the cerebral arteries.
You said the agility is middle cerebral line.
So if you've lost motor and sensory, because that's your precentral gyrus and postcentral gyrus, that's middle cerebral artery supply. So, insula, temporal lobe, and lateral, frontal and parietal lobes. Then we have the two small vessels that are the anterior cerebral. And they're going to come together between the two lobes, so through the longitudinal fissure. And they're going to pass over the corpus callosum. And they're going to supply the medial surface of the frontal and temporal lobes and the diencephalon, the thalamus and hypothalamus. So here's the anterior cerebral, and you can see it going over the corpus callosum and supplying all of the medial surfaces of anterior and parietal lobes. Again, occipital lobe is done by the posterior cerebral, okay? So here's the anterior cerebral, kind of like a rooster tail, coming over corpus callosum, doing all of the medial surface of the frontal lobe and parietal lobe, all right? And its branches actually kind of wrap over the top of those lobes right there like that. So anterior cerebral, all along here. It's going to be doing the diencephalon as well. And the medial surface is of frontal and medial surface is of parietal, but not posterior. Okay. So anterior cerebral, wrapping around to here, doing medial surface of frontal, medial surface of parietal, and diencephalon. Okay. So anterior cerebral, applying medial surface of frontal and parietal, and diencephalon is some of it fibers going over, branches going over the top. So the two anterior middle will be like that. Right on here. Medial, frontal, and parietal, and the diencephalon. Okay. Can I show you guys? From there. Okay. All right. So we don't have these two units joined yet in case there was a blockage. So now we need to join them. And we have three vessels that do that are called communicating. All right. So they have smaller regions of tissue that they're going to supply that I'm not going to hold you responsible for. So connecting the vertebral system to the carotid system. We have the posterior communicating. There's a pair of them. That will be, well, let me put Tony up here, is our anterior cerebral.
So the anterior cerebral is a branch of the internal carotid?
Yes. Uh-huh.
And did you say the posterior cerebral was a branch of the basilar?
Yes, it's the terminating branch at the dead end component of basilar. So And then we'll have medial, frontal, again, diencephalon is thalamus and hypothalamus. So 21 are the two posterior communicating arteries. And that connects the vertebral system to the carotid system. And then we have a single anterior communicating that connects left to right of the carotid. Okay. So if we look at the diagram, here's the basilar dividing to form the pair of posterior cerebrals connected to the internal carotid by the posterior communicating. Here are the two anterior cerebrals curving along here like this, connected by the single anterior. And you can also see these in that skull vertebral model, and some of them in this model, okay, if you take off the top of the skull. You can also see a really good view of the anterior cerebral artery here, going over the corpus callosum, and a tiny little piece of posterior cerebral down here, supplying the occipital lobe. Okay. All right, any questions on this? We're gonna do the blood supply to the upper limb, which is pretty basic, and then we'll take another break, okay? And I'm gonna give you a longer break, so you can come look at these models and get familiar with them before we come back and finish up with the abdominal and pelvic cavities. Which I actually find easier, because those arteries are named for the organs that they go to pretty directly. So it goes to the stomach, it's gastric. If it goes to the liver, it's hepatic, and so on. Okay, question number 4, while I erase the board. May I erase the board? Okay, so which of the vessels listed below supplies arterial blood to the thalamus and hypothalamus? number we used for the anterior communicating, 22? 22? Okay. So, we'll call the subclavian artery, which is, on this case, brachiocephalic is gonna divide into common carotid and subclavian. Whereas on the left side, the subclavian is gonna come directly off of the aortic arch. Just like the left common carotid, there's no brachiocephalic on the left side of the body. There used to be in embryonic development, but as the aortic arch developed, it kind of resorbed it into the arch itself. So question, number 23 will be the subclavian. There's another branch off of the superior aspect of the subclavian. In the lab, I list several subsequent branches of this, but you don't need to know those, all right? This is called the thyrocervical trunk. Remember I said trunk doesn't supply directly anything, but branches off of it does. The thyrocervical trunk actually has about 7 branches. So it's going to supply regions of the neck as well as the back of the shoulder. The reason I do put it up here is because some of those branches, anastomose, there's that name again, join with branches coming off the brachial artery. So if there's a clot, blood can still get around the shoulder and down to the upper limb without being completely blocked off. All right, so we're at this area right here, and here's the thyrocervical trunk. So it's going to supply the thyroid gland as well, it's going to do neck muscles, and it's going to do shoulder muscles. Okay? That's essentially what I want you to know for it. So cervical trunk. In the lab, I believe I list a couple of branches like suprascapular artery that runs across the top of the scapula and back, but you don't need to know any branches, okay? So it's going to do anterior and lateral neck and shoulder. I'll just leave it at that. We're going to come back and look at an inferior branch off of the subclavian, but we're going to do the upper limb first. Okay? So subclavian means deep to the clavicle. The subclavian artery runs along the base of the neck, and then it does pass deep to the clavicle. When it emerges on the inferior aspect of the clavicle, we call it a different name. Still the same vessel, we just call it a different name. So when we see it again here, passing in the axillary area, no big surprise, it's now called the axillary artery.
Would it be considered a branch of the subclavian, or just?
It's a continuation.
Okay.
It's a terminal branch, if you want to think of it that way. It's not a branch off of it, but it's what the subclavian becomes, kind of like the external carotid becomes a superficial temporal. It's its last named component. So if I were to say which of the following is a branch of the subclavian, you would consider, because it is.
But you would consider it?
Yeah, because it's a continuation of it, blood's gonna flow from subclavian into the axillary, just like it would flow from the subclavian into the vertebral. So, 25 is axillary. This is a little bit like our streets, where you're traveling on one street and all of a sudden it's a different name and you never turned off of it, okay? So as you go through this vessel, you're never actually leaving it, and it starts changing names. The next time it changes a name is when it passes deep to the teres major muscle. That's the muscle on the lateral aspect of your shoulder. And when it emerges again from the inferior aspect of that, it's going to have another name. And now it's considered to be in the arm itself. And as we said earlier, in brachiocephalic, our word for the region of the arm containing the humerus bone is brachial. So this is now the brachial artery. So it runs along the humerus. does give off branches that supply the muscles in the arm, like the biceps brachii and the deep muscles of triceps brachii. But you don't have to learn any of those branches, okay? I'm gonna draw it a little bit short here. This person's not gonna have a very long humerus bone, just so I can get this done above the lowest level of the whiteboard. And about the elbow, it's going to divide into arteries that follow the two bones of the forearm. By the way, the brachial artery is the one that gets compressed by a blood pressure cuff, and it's the one that you listen to with the stethoscope. As you decrease the pressure of the cuff and allow blood to flow back through it, it creates the disturbance, it creates the sounds when you're measuring someone's blood pressure. That's the brachial artery, okay? When we do pulse, you can find the brachial artery by taking your hands and kind of pushing here and then kind of rolling it against the humerus bone. And you usually should be able to find the pulsation from the brachial artery there. All right, so I'm gonna have my elbow up here, all right? We're not gonna have a very long arm. And it's gonna give off a lateral branch and a medial branch. And I'm being rather simplistic here. There's lots of recurring and other branches around the shoulder. So the lateral bone of the forearm is on the thumb side, is what? The radius, and the other one is the ulna. So we label our vessels by those names for the bone. So 27 is going to be the radial artery. That's usually the one that we palpate for a pulse, okay? The medial one is the ulnar artery. So we're here now. And then the radial artery and the ulnar artery join together at a superficial and a deep level to give rise to the palmar arches. So I'm going to draw that over here just so you can see a little bit better, all right? And I'm actually going to use a different diagram where the hand is in this position. So notice this is the radius side and this is the ulnar side. So here's the radial artery, here's the ulnar artery, okay? Radial artery is 27, ulnar artery is 28, only we're looking at it this way instead of this way. So, the superficial palmar arch is just below the skin and some of the connective tissue, and it's going to be the longer one, the one closest to the fingers. It actually gives rise to the vessels that go to the fingers. And most of it comes back and it joins the radial artery. But I drew it wider on the ulnar side than I did on the radial specifically, because the ulnar artery gives most of the blood flow that goes to the superficial palmar arch. So 29. is superficial palmar arch. And then the radial artery gives off a branch that goes around the outside, the back of your thumb, and comes in through this web space and creates the deep palmar arch. So a little bit closer here, deep to the vast band of connective tissue of your palm. It's going to pass around the thumb and come in. So most of the blood supply to the deep palmar arch comes from the radial artery, okay? And that will be 30. So I'm going to write ulnar artery in blue under superficial to remind you that that's where most of its blood supply comes from. And radial artery in blue under deep. Just to remind you that that's where most of its blood supply comes from. Okay. Digit is another name for fingers. So coming off the superficial, we have 5 sets of common digital. And then these split to go along the lateral aspects of each of the fingers. So not down the middle, but on the sides. This is where our nerves go as well, okay? So if you get your finger caught in the car, someone slams the door on your finger, or you close a garage door on it, if you squeeze it this way, it's not as likely to get numb and bleed a lot as if you cut it or squeeze it this way. That's where the nerves are, and that's where the blood vessels are on the side, okay? So traveling up, you can see a split here. So going up the inside and the outside of each finger, not the ventral or dorsal surfaces. So these are known as common digital and digital proper. Or proper digital. Common, and the fingers are proper. Digit means finger, so that's all we're talking about. Okay, so the common is a single vessel, and then the proper are where it splits and actually travels along the finger. Common's gonna be in the palm of the hand. Okay, before we take a break, I'm gonna do the 2 vessels of the chest, 3 vessels of the chest wall. And then we'll take a break. So, let's trace a drop of blood to the left little finger. So we have a drop of blood coming up the ascending aorta. Is it gonna go out the brachiocefalic trunk? No, because we're going to the left side. So it's gonna go into the arch of the aorta, and then the subclavian. Then it's gonna go to the axillary, down the brachial, and I said little finger, so it's gonna go into the ulna. And I said finger, so it's gonna go into the superficial palmar arch, because it's in the ulna anyway. And then out the common and down the proper digital, and then it's in the little finger. Okay? So again, I just did a sequential map. And here we're naming it for bones and regions, so it's subclavian until it gets under the clavicle, then axillary as it goes through your armpit, axillary is armpit, down the arm, the brachial, and along either the ulna or radial bones. Okay? Okay, so the last set of vessels we're going to do are going to be in the chest. And what do we call the muscles that we find between the ribs? Intercostal muscles, all right? So the vessels that travel between the ribs are called the intercostal arteries. The anterior intercostal arteries are going to come off the front of the chest. They are going to meet and be continuous with posterior intercostal arteries that come from the back of the chest. So what major vessel do you think we have in the back of the chest, the posterior chest wall? Major, major, major. It's an elastic artery, it's so major. It's the largest elastic artery, it's so major.
It's the aorta, right?
Aorta.
Yeah, okay.
So the thoracic aorta is coming down behind the heart. And so off of the thoracic aorta, we have pairs of vessels that come out the back of the thoracic aorta and go between the ribs. Posterior intercostal arteries, all right? So let's continue the thoracic aorta, which I believe I numbered as number 4. And then we're going to have pairs of arteries coming kind of from the back. Now, it's already on the left side.
Number 3.
Oh, it's number 3, thank you. So the left posterior intercostals are actually going to have to travel over the vertebral body. I mean, the right intercostal arteries are going to have to travel over the vertebral bodies to actually get to the right side of the chest wall. So 29 was our last, no, 30 was our last number. So all of these together are going to be the posterior intercostal arteries. direct branches off of the thoracic aorta. Now, what major vessel do we have? Well, let me change that. What vessel do we have from which the anterior intercostal arteries can come from? It's not up there, by the way. Well, it is, I just don't have it numbered. See this little vessel right here? That is going to travel down on both sides, but I'm only going to draw it on this side. It's going to travel down the front of the chest, just about an inch from the sternum. And it's going to give off branches that travel laterally. It's going to continue to the diaphragm, but we're not going to worry about that, okay? So if these are the posterior intercostals, what do you think these are? The anterior intercostals. The vessel that they come from, number 32. Same on that side, I'm just not drawing it. It's called the internal thoracic artery. I'll show it to you on a chest wall model in a moment. There's a pair of them that we have right and left sides of the chest wall. This model only shows one side though. So it's showing the veins as well, which we won't talk about until Thursday. But here's the deep surface of the sternum. It's back here already. And there's the internal thoracic artery with anterior intercostals coming off between the ribs. So running just lateral to the sternum on each side. Okay? So internal thoracic artery giving off coming this way that will meet the posterior intercostals, and these are the anterior intercostals.
The internal thoracic is a branch of what?
It's a branch of subclavian. So here's internal thoracic and anterior intercostals. Okay? Internal thoracic that comes off subclavian, and anterior intercostals coming off of internal thoracic. Okay? Internal thoracic, anterior intercostal. Internal thoracic, and anterior intercostals, which will meet in the midline. Okay? So internal thoracic, anterior intercostals. Okay? Now we have a, let me write the internal anterior intercostals up there. So we have this intensive looking model that you can find online if you look up wire cardiovascular model. However, let me reassure you, I don't use everything on here, all right? I would much rather tag a vessel when you can see the organ in which it's going rather than these wires sticking out in space. So I will not tag maxillary or external or occipital and stuff like that on here, or even the middle cerebral and all of that, because you're trying to interpret the model rather than seeing it more represented inside the skull or on the side of the face. Nor will I tag the abdominal vessels here, all right? Chest is good, and our upper extremities and lower extremities, okay? So for the upper extremity, you can see the subclavian. This area right here where all the branches are is going to be axillary. Down here would be brachial, and you can see it dividing into radial and ulnar. For some reason, this one has 3 arches. There's only 2, so I don't know why the model puts 3, but we won't use that one for the arches, all right? And it's good for the lower extremities. What I want to show you here, see this vessel right here? Coming down, that's internal thoracic, okay? So this is internal thoracic. You can see it giving off lateral branches. And then if you turn around and look at the posterior view, posterior intercostals are coming off of the thoracic aorta. And they meet in the midline, and you can't tell where one stops and the other begins, okay? So be sure and take a look at this one for a three-dimensional aspect of the internal thoracic and the intercostals, rather than trying to get it just from the lab. From the lecture. Okay, now, very, very, very last one before we take a break. I know I have something to do. Great, but I forgot about this one. We'll come back to that one. Okay. Posterior intercostals, internal thoracic, but right up there on the anterior surface of the thoracic aorta, you can see these vessels right here. They're called bronchial arteries. We never see them in models, okay, because the heart's always in the way and they never diagram. So I'm going to make them solid just so you can visualize them and distinguish them from the intercostals. So 34 are the bronchial arteries. And their function is to carry oxygenated blood to the lungs. Do we already have vessels that do that? They are called what? What are the vessels that are carrying oxygenated blood to the lungs? What are the vessels leaving the heart carrying blood to the lungs called? Pulmonary trunk, which divides into the pulmonary arteries, and that's carrying blood to the lungs. Is it oxygenated or deoxygenated? It's deoxygenated. That doesn't help the lung tissue out, which is muscle and cartilage and epithelia, and it needs its own oxygen. Can't get it from the alveoli because they're too far away. Pulmonary veins are carrying oxygenated blood, right? But that's carrying it away from the lungs. So the bronchial arteries are carrying oxygenated blood to the lungs for their own nutrients and oxygen supply. So all the tissue of the lung, the muscles, the cartilage, all of that is not able to get oxygen from the alveoli. So interestingly enough, the pulmonary veins pick up oxygen, carry it back to the heart. The heart then pumps it out the aorta, and it comes out the bronchial arteries and goes back to actually supply the lung tissue with oxygenated blood. Okay, let's stop there. I'm going to give you a break until 10 after, all right? And because I want you to have some time to look at the head models and the brain models if you want to, and find some of those vessels that we've talked about, maybe the torso. So when you come back on Thursday, it's not so brand new, okay? And so at 10 after, then we'll come back and we'll finish up the blood vessels of the abdomen and pelvis. It'll probably take us about 35 minutes, okay? And then we'll stop with that. So take your break, get your brains moving, have the blood moving for your posterior and middle cerebral arteries and anterior cerebral arteries. Take a gander at the head models or the skull models over there if you wish. I have a brain model up here.